right, welcome to today's clinical masterclass. In this explainer, we're diving straight into exactly how we harness the invisible power of interferential therapy, or IFT, to accelerate healing and safely relieve severe pain in our patients. If you're learning how to use electrotherapy in a real-world clinical setting, well, understanding this tool is absolutely essential. We're going to get a really close look at the exact machines you'll be using and talk about exactly how to treat the patients on your table.
Here's our clinical syllabus for today. We'll start with the science of interference, then meet the IFT machine, cover how IFT heals, discuss when to use IFT, and finally wrap up with treating the patient. Okay, let's jump right into section 1, the science of interference. We need to nail down the core principles here. So IFT is a highly effective form of electrical stimulation that's used all the time in physiotherapy. And the real kicker here, the crucial point, is that we deliberately take two slightly different medium-frequency currents and apply them at the exact same time. We're basically forcing them to intersect to produce a completely new therapeutic interference current deep within the patient's body tissues. Now, you're probably wondering, why use a medium frequency? I mean, it's usually set right around 4,000 hertz, and there is a very specific practical reason for that. This higher rate literally just glides right past the skin's natural electrical resistance. It reduces skin irritation almost entirely, which allows the current to penetrate much deeper, while your patient is just perfectly and comfortably resting on the table. Okay, so here's where the physics magic trick actually happens underneath the skin. Imagine your setup. You send current 1 at 4,000 hertz into the tissue, and at the exact same time, you send current 2 at 4,100 hertz from a slightly different angle. Deep inside the patient's muscle, these two currents intersect and physically interfere with one another. Because they're just slightly out of sync, they clash, and boom! This interference creates a brand new low-frequency wave that we call a beat frequency. So in our example of 4,000 and 4,100 hertz colliding, the resulting beat frequency is exactly 100 hertz. And guys, this is the absolute secret of IFT. It's this internal low-frequency effect that actually stimulates the nerves and heals the tissues. And you get all of that without the painful stinging sensation of a standard low-frequency machine. Moving right along to section 2. Meet the IFT machine. Let's get an overview of the actual equipment. You really got to know your tools intimately. Every IFT machine consists of a main unit that houses your intensity and frequency controls. You've also got a built-in timer to monitor treatment duration, your lead wires, and of course, 4 individual electrodes that you're going to carefully apply to your patient. Now, you've basically got 2 ways to apply this. First is the bipolar method, which only uses 2 electrodes. In this setup, the interference actually happens inside the machine itself, before the current even reaches the patient. The other way is the quadrupolar method. This is for sure the most commonly used method in the clinic. It uses all 4 electrodes placed in a crisscross pattern right around the painful area, which ensures that the therapeutic interference happens perfectly within the patient's actual tissues. All right, section 3, how IFT heals. Let's talk about the physiological effects. When that beat frequency starts pulsing through the tissue, the physiological responses are just rapid and amazing. By stimulating the sensory nerves, we can achieve some profound pain relief. But remember, we aren't just putting a Band-Aid on the pain here. We're actively increasing blood circulation, which directly leads to the reduction of edema and inflammation. It's also awesome for muscle stimulation and strengthening. It accelerates tissue healing, and it can literally stop painful muscle spasms right in their tracks. This right here is essentially your ultimate clinical cheat sheet for dosage selection. You have to dial in the exact frequency range based on what you actually want to achieve. Need muscle stimulation? Set the machine to 1 to 10 hertz. Looking to trigger a rush of endorphins? Dial in 10 to 50 hertz. For pure, targeted pain relief, 80 to 150 hertz is your sweet spot. And if you have a patient dealing with chronic pain, well, you're going to want to use a sweep setting from 0 to 100 hertz. That brings us to section 4. When to use IFT. Let's look at the clinical indications. Because it penetrates so deeply and honestly feels pretty great for the patient, you can use IFT for a massive variety of musculoskeletal and neurological conditions. You'll be pulling this tool out for patients suffering from low back and cervical pain, osteoarthritis, and sciatica. It's also incredibly effective for things like frozen shoulder, muscle spasms, acute sports injuries, localized edema, tendinitis, and even post-traumatic pain. But hang on a second. before we even think about powering up that machine and placing those pads, we have to ask a really critical question to ensure patient safety. When is electrotherapy actually dangerous? Your clinical supervision is absolutely paramount here, so pay very close attention to these contraindications. You must never, ever use IFT on patients with cardiac pacemakers. It is strictly a no-go. Over the abdomen or pelvis during pregnancy, you also can't apply it to areas with suspected malignancies, thrombosis, or active infections. Plus, stay away from areas of sensory loss, open wounds, unless you have a very specific indication for it, and absolutely never apply it to the head or neck region of a patient with epilepsy. Which brings us to our final section, Part 5, Treating the Patient. Let's walk through the actual application steps. Just keep your pros and cons in the back of your mind as you start treating. The big advantages are that IFT is a highly comfortable treatment, it causes way less skin irritation, and offers a much deeper penetration of current, which makes it great for both acute and chronic stuff. However, on the flip side, it might only provide temporary relief for some conditions, it requires your continuous clinical supervision, and it absolutely demands precise, proper electrode placement to work at all. All right, here is your game plan from start to finish. First, communicate, explain the procedure, and get your patient positioned comfortably. Second, clean the treatment area properly to improve conductivity. Third, place those 4 electrodes in that precise crisscross pattern right around the pain site. Fourth, select your frequency and intensity on the main unit based on whatever your therapeutic goal is. Fifth, gradually crank up that intensity just until the patient feels a comfortable tingling sensation. It should never be painful. And finally, treat them for the standard 10 to 20 minutes, making sure to observe how they're responding throughout the whole session. So as we wrap up this explainer, I want to leave you with a thought. You now know the physics, you know the equipment, and you have the exact clinical procedures down. Proper assessment and dosage selection really are everything. So with so many variables in frequency and placement, how will you tailor the invisible power of interference to perfectly address your very next patient's specific pain? Keep that in mind next time you head into the clinic, and I'll see you in the next explainer.